impressive product.
Well, and let's take a look at what Dr. Kirby was
This is one of my
about.
favorite pictures. If you look at this picture, let's compare left to right, and that's before to 8 weeks after. Let's go clockwise, starting at 12.
Okay.
The upper lid, this person applied to their upper lid. You see a really nice reduction in that upper lid there. It's smoother, it's softer, it looks more relaxed. But where it's really impressive is at the 3 o'clock mark. Look at those crow's feet. It's such a significant reduction there. I mean, they're at least 50% reduced after just 8 weeks in this picture.
You can really see the difference.
You can really see a big difference. And as you go underneath the eye, look at that. That line of expression, that under eye crease is virtually gone. The dark circle has improved significantly. And you can't really quantify dryness with a photograph, but that's the sixth sign of aging that this works with as well.
You can see the texture under her eye.
Oh, it looks so plump.
Much more
it looks,
supple, yeah.
Exactly.
That is beautiful.
Now, one of the reasons that this study was done at 8 weeks, why? Because that skin cell cycle is 35 to 57 days, or approximately 8 weeks.
Okay, so there you can see, using this on a regular basis, once a day? Or?
Use it once a day. Now, if your area of concern is just the eye, you can absolutely use this product alone.
Okay.
I use it as a companion product to the stabilized retinol product we talked about earlier, the full facial serum. So this product, you want to use at the opposite time that you're using the serum. So if you use the serum during the day, you can use this at night, just in case there's a little bit of overlap.
Okay.
Or if you're using the serum at night, you can use this during the day.
Okay.
Once again, this should be the first thing that comes in contact with your skin because it's an actual treatment.
So wonderful. So we don't have to apply another cream or anything on top of this.
This is so luxurious, and although it's very smooth and silky, it definitely has some body to it, so that it really gives you some nice moisturization there.
So a wonderful, and I love the fact that the Neutrogena Dermatologics line really is, it's sort of like one product does it. You know, you don't have to have 17 products that go in that one spot to kind of target different things. One product seems to really target all of them.
Because they're fusion products, so even within this tube itself are those 3 products. That stabilized retinol technology that we love, stabilized vitamin C, it's an antioxidant, fights oxidation, fights the aging process, and then the biopeptide CL, which helps plump and improve the look of aging skin.
So for a lot of you who are watching, and maybe as you're saying, you know, your skin is still looking pretty great, but you're starting to see some of the expression lines around the eye stay a little bit longer. Maybe the darkness under the eye area, a little bit of crow's feet, maybe some puffiness. You're saying, okay, I really want to target that. Is there an age, I mean, as a dermatologist, is there an age where you see people starting to come in?
That's an excellent question, and I get that all the time. And I tell people there's really 2 ways that you can start an anti-aging regime. You can wait until you start to see the aging process, and then you can start using the regime. And that happens very, very frequently. People, you know, they didn't think they needed anything, and then they hit their late 20s, early 30s, late 30s, early 40s, and they really start to need something. Or you can prophylactically start the fight early. And if you say, you know what, I'm looking at my mom, I'm looking at my grandmother, I'm looking at my friends, I'm starting to notice these signs with them, let me start using a product ahead of time. That's where stabilized retinol technology comes in.
So be proactive, you know, start targeting those areas.
Well, it's never too late, but it's also never too early.
Yes, and that's a good point. So if you're in your 20s and you want to be able to stave off that aging process a little while longer, you know, we can't eliminate it. It's going to happen.
Of course.
But also if you are in your 60s, 70s, 80s, so you're saying it's not too late to use the Neutrogena Dermatologics.
I have a number of patients who are in their 70s, 80s, late 80s who absolutely love this line because it is moisturizing in its effects as well, and that superior moisturization occurs within the first 24 hours.
It's real. I mean, it's truly fascinating to me. I mean, seeing how we can use products so topically now, easily and topically, that makes such a huge difference. I mean,
there's been incredible jumps in technology within the last 5 years, and one thing I tell all my patients is go to your medicine cabinet, take all of your products. This is a little tip that people, you know, if you do this, it's so intuitive. You don't really think of it, but when you do it, you'll be like, wow, I didn't think of this before. Take all your products and turn them backwards. Put the back label backwards toward you. And then use your normal regime for a month. And every time you use a product, turn it around so the front label is facing you. At the end of the month, if any of those products are facing backwards, throw them away because you're not using them, and there's a reason you're not using them, because they simply don't work. Technology has changed greatly, and you can have a regime that's very, very simple and very, very effective.
Yes, exactly, and very streamlined, which we love as well. Something that doesn't take a lot of time, gives us the results we're looking for from a company, as we mentioned at the beginning of the show, that's really well known around the world. I mean, it's 40 years, 70 countries plus.
Exactly, and there's 17 patents associated with that stabilized retinol technology.
Really?
So it's an incredibly, incredibly well researched, well documented, and that's that's why we have the before and afters. That's why we have the studies that back up all of the claims.
Exactly. And so many of you, of course, very, very aware of the Neutrogena line. This, of course, is the professional series from Neutrogena, and it's available exclusively here only at the shopping channel. So that is, of course, the Retinol NX eye cream available for you here only in Canada. 431849 is the item number at $60. As we continue shopping and sharing our last visit, last visit, I should say. Last visit sounds very permanent.
Right,
No, we're going to have
terminal.
Dr. Kirby back. But right now, we also want to share with you from Neutrogena Dermatologics, this is the Retinol NX Wrinkle Filler, available for you today only at $60. So we have dropped $15 off of our regular pricing. Added, of course, the easy payments, 2 payments of only $30. So you can get this at home for basically half the price for the first 30 days on your credit card and discover it. And as we mentioned, you can only get this line here at the shopping channel. Chances are as well, you've read about it. It's been editor's choices.
Oh, absolutely. It's incredibly popular.
Choices.
Very much so. It's a very, very popular product. Something you mentioned earlier is how technology really jumped in the last few years, and this is a product that really exemplifies that. This is called Wrinkle Filler. I think it should be called the Wrinkle Fighter because that's exactly what it is. Once again, it's a targeted product. At the top of the show, we talked about a full facial product to fight the aging process.
Yes.
Then we talked about a targeted eye product. This is a product that is specifically targeted, as the name suggests, for those deeper lines, those deeper crevices, those deeper wrinkles.
Really? So this goes specifically in certain spots, right?
Absolutely. Now, we talk about these are fusion products. This is a before and after picture if you want to take a quick look here. If you have a high-def television, high-definition television, take a close look at the forehead wrinkles or in between the brow. Or if you want to scoot a little closer to the TV, you'll notice a very, very nice difference. This patient in particular was so thrilled about the products on the cheeks. She noticed a number of wrinkles on the cheeks that had a nice reduction. Now, this before and after took place over the course of 8 weeks. And if you notice overall, around that eye area, between the brow, on the forehead, and the cheeks in particular, you really notice a nice softening of some of those deeper wrinkles.
Yeah,
and people say to me, well, where can I use this product? Anywhere you're having deep wrinkles. Maybe you have forehead wrinkles, but not nasolabial lines. Nasolabial lines are from the nose to the lips. Or maybe you have marionette lines. Those are from the bottom of the lip to the bottom of the chin. But maybe you just have a line in a specific place. In between the brow is where people really start to notice those first lines.
Those deeper,
and that's the deeper creases, deeper lines, deeper crevices. That's where this product works incredibly well.
So use this, as we said, targeted. Now, okay, so what is the sequence? We've used our all-over serum.
Yep, and much like the eye product, this is a targeted product. Use it the opposite time you're going to use the all-over serum. So if you use the serum during the day, the full facial serum, then you use this at night, or vice versa.
Okay, well, it's very simple. Thank you for that.
It's actually
not
very,
complicated.
you know what I tell people, let the scientists, let the dermatologists like myself worry about the technology. 17 patents are associated with that stabilized retinol technology. So much research and development goes into each of these products. You just worry about being compliant with your regime, using the appropriate amount, and remembering to do it every day, and you'll get a beautiful result after just 4 to 8 weeks, 35 to 57 days.
Really? So it's going to help to plump up those areas where we have the deeper wrinkles?
Well, let's talk about how that works. Once again, this entire line is the fusion of technology. So it has that stabilized retinol technology, but it also has hyaluronic acid. Now, what is hyaluronic acid? Hyaluronic acid is a naturally occurring substance in your body. It's a thick, gelatinous material, and as we age, we lose it. And that's why the aging process slowly comes down to the effects of gravity, and you get more of those fine lines, those wrinkles, because of the loss of that hyaluronic acid, among other things. Another tangential note here is when people come to my office to get wrinkles injected, I do that process, and it's expensive, it's painful, and what do we inject? Hyaluronic acid. So now that hyaluronic acid is available in a topical form. And the way that I explain how it works, if maybe we could focus in on this vase for just 1 second here. Imagine the water in this vase is the natural occurring moisture in your skin or on your face, just moisture in the air. And then imagine this hard sponge here is that hyaluronic acid.
Okay.
What happens when they come in contact with each other? Hyaluronic acid, true fact, can hold up to 1,000 times its weight in water.
Really?
So hyaluronic acid gets in contact with that moisture in the air, in your skin, and it slowly, actually pretty quickly plumps up. So you see an effect very, very quickly. Within the first 24 hours, you notice a reduction and improvement in the lifting appearance of those fine lines and wrinkles, but it continues to work over time as well because of that stabilized retinol technology.
Okay, so we get the pretty much immediate benefits and the cumulative benefits.
Correct. That is
top of that.
absolutely correct. And you can think of it as sort of a micro sponge technology. It's plumping up very nicely. The sponge itself is when you expose it to that moisture because of the hyaluronic acid.
So that's something you were mentioning earlier when we were talking about the serum, about babies, small children, they have that wonderful plumpness to their skin.
They have so much hyaluronic acid. Those cells are rapidly dividing, producing tons of hyaluronic acid. That's why they have, they're one of the reasons why they're chubby and the skin is so tight and bouncy. And as we age, we lose that turgor. Oh,
do we ever? Well, there's so many signs of aging that come along, don't there? Aren't there? And it's so wonderful to have topical products that really make a difference. As I've said before, gone are the days of my grandmother's slathered on.
Of course.
I mean, we're really getting targeted, amazing ingredients, including, as we said before, that amazing retinol, the hyaluronic acid, also included for you in a line that is a professional series from a name that you already know, Neutrogena. Chances are, like myself, you use Neutrogena products over the years, maybe starting in your teens and going forward. This is the professional series, and it's only available here at the shopping channel. So, as we said, it's $60 today, and today is coming to a close because this is the last presentation for the day, a great opportunity, and we'll just show you after one application the difference that is going to occur.
This is, like you said, one application, just using it once. 72% of users showed improvement in the appearance of crow's feet fine lines. That's just a good area to start. That's an area that we often use as a baseline to really note where wrinkles are. But you get that hydration, exceptional hydration. It lasts up to 24 hours, and that's just using it one time. At 4 weeks, that's where we really got incredibly impressive results. Why 4 weeks? That 35 to 50-day skin cell cycle turnover. 90% of users showed improvement in the appearance of those crow's feet fine lines. 81% of users showed improvement overall. They noted that their overall skin appearance looked younger.
That's great.
So that's incredible.
That's
81%
amazing.
After just 4 weeks, and even at 8 weeks, you get more of those great benefits. So,
well, and as you were saying earlier, there is, I think, for a lot of us, there is a disconnect between how we're feeling on the inside and what's looking back at us in the mirror, right?
Of course, absolutely.
A lot of the baby boomers, we're feeling pretty vital, and we're trying to take care of ourselves, and then the face looking back, he's going, wow, that looks totally different.
Who's that?
Yeah, who is that? So this is a great way to help turn back the hands of time, as you said, looking younger even after only 4 weeks of using the wrinkle filler, and then combining that with, of course, the eye cream we were just sharing with you, and then at the opposite end of the day using the all-over serum. You've got a really great trio of products.
Oh, it's so simple.
Great skincare.
I think that's a great way to think of it. It's so simple to start a regime that's going to really make a big, big difference. It's a difference that you'll know, but it's also a difference your friends and family will say to you, did you get a good night's sleep? You look, well rested. Something's going on here, and it can be attributed to just a really good regime.
Well, and as Dr. Kirby was saying, I mean, you do a lot of the procedures that people ask for in your practice.
Of course.
So this could be used either in conjunction with that to help that maybe last or that look last a little bit longer.
Of course.
Or maybe you might want to try the Neutrogena I don't want to take business away from you.
No,
but,
I always tell people there's a hierarchy, and that hierarchy begins with a really regimented, simple regime. You just have to be compliant with it. And then you can always add other things. You can add procedures after the fact, but you always have to, no matter what, have a really good regime to start with.
And here it is, exclusively here at the shopping channel. Thank you so very much.
The pleasure is all mine. Thank you very much. I really appreciate you having me.
Have fun flying back to warm LA. Let's recap what we've